Well, the queen of rock and roll, Tina Turner, died at the age of 83 yesterday. She suffered from numerous illnesses in recent years, including intestinal cancer, stroke, and kidney failure. And joining us now in studio to talk about her health issues is Fox 5 medical contributor Dr. Richard Chaffoux. Thank you so much for joining us.
Good to be here.
You know, as we talked about it, we know she suffered from several things. When did Tina Turner have a stroke? And really, I mentioned a few of the illnesses that she was suffering from. What did we know of that she was suffering?
Tina, I think, sorry, Maria, I think the issue was that one of the earliest diagnoses that she had, unfortunately, in the 70s was hypertension. And at least if you read some of the reports, it looks like it wasn't really well treated or wasn't managed with medication. So if you have early hypertension, oftentimes there are no symptoms at all, and it can lead to many of the other illnesses that she developed. One of those, of course, being a stroke, is very often associated with hypertension that's not well controlled. She
also had a kidney failure issue.
Yes.
She had a transplant.
Yes.
What happened with that?
Probably the same issue. You know, if you have uncontrolled hypertension, the problem, it affects our vascular system throughout our body. So renal failure is a common consequence of untreated hypertension, much as heart failure. I think there were some reports that she had some issues with heart failure as well, and the stroke. All of those seem to be coexisting morbidities associated with, most likely associated with her hypertension.
What are some of the symptoms, I guess, for chronic kidney failure?
So for chronic kidney failure, you can have fatigue, weakness, joint pain. You may have a change in urine output, a lot of itching, but sometimes very early on, Maria, there may not be any symptoms. So that's why, you know, we always encourage patients to get in to see their physician for annual examinations, much as hypertension oftentimes is completely asymptomatic until you have another illness that makes you see your doctor. You start having chest pain, you go to your doctor, and you have angina, but you have hypertension that probably was responsible for causing the angina.
So high blood pressure can really lead to all of that.
Yes, it is a systemic illness. And it can happen in very healthy people. And of course, you know, she was very fit. I mean, very aerobic, obviously, active woman. But hypertension is definitely a silent killer.
Let's talk about the intestinal cancer. What do we know about that?
So what we know is there may be a family history. I think that her son had died recently from you know, complications, unfortunately, of intestinal carcinoma. Intestinal cancer, again, can also be somewhat silent, but sometimes there are some earlier symptoms. Patients may notice a change in their bowel habits. There may be blood in the stool. They may have some abdominal distension or swelling or discomfort, fatigue from chronic blood loss. So again, it's important to, you know, listen to your body and be very cautious. You know, most recommendations now, the American Cancer Society recommends at the age of 50, we should have a colonoscopy done, because some of these can be very early in small, tumors or polyps, and it's important to get those treated very early on.
You know, it's interesting, her son Ronnie did die of that, and for her to be even diagnosed with that. We're hearing about vertigo as well. That was an issue for her as well.
Yes. And vertigo is another very incapacitating illness that can be due to a number of causes, one of which can be hypertension. And people that have vertigo, Maria, typically have this sense of spinning, and that can make you quite unbalanced. You can have problems with difficulty hearing, ringing in the ears, diminished hearing. So it can be quite incapacitating. And of course, she was not only an amazing singer, but a dancer, and she did describe how that did affect her balance and her ability to perform.
You can't even imagine her not being able to do those things. That's what she's best known for, is her performances. And every time I talk to you, I start thinking I have everything that you talk about because you mentioned all those symptoms, but thankfully my hypertension is being treated. There you go. All right, Dr. Richard Chaffoux, we appreciate your insight on all of it.
Pleasure,
and definitely
Maria.
some tips that we need to remember when it comes to our health.
Yes.
All right, thank you.
Thank you.